Hello everyone, this is Dr. Shravani Pulluri, Clinical Director, Nest Fertility Center, Madinagoda. So today we are going to discuss about symptoms of pregnancy. So how do you usually diagnose that you are pregnant? So basically when you skip your period, you can do a test called serum beta HCG. So serum beta HCG, like if the value is more than 5, we usually consider it to be pregnant after it gets confirmed with a scan. So urine test usually doesn't show positive immediately the next day when you skip your period. It will be either weekly positive or the line will be even more faint. So you can wait for 2 to 3 days and then the urine test will be like clear, it shows clear positive. So before that the blood test usually confirms whether you are pregnant or not. So in blood we get to know early than in urine. The beta HCG hormone, it gets released in the blood earlier than in urine. So this is one of the way to confirm whether you are pregnant or not. And then how and what are the other symptoms that people face when they are pregnant. So initially they face mild weakness and like the difficulty in doing the household work and all because of weakness, and they usually have the early morning sickness, and as soon as they get up from the bed, when they start brushing, they'll usually have this yellow color vomiting. So because of this vomitings, they usually have dehydration and they usually feel very weak. So we advise adequate hydration for the pregnant woman, so that usually they don't go into dehydration, as this is summer coming next. And after this vomitings, the one more symptom what they face is going to washroom frequently. So this happens because of the growing uterus. It puts pressure on the bladder. So because of this, they won't be able to empty the bladder completely, and they'll have the feeling of incomplete emptying always. So because of this, they feel like they want to go to washroom very frequently. And one more thing they usually face is in the first trimester is they like don't feel like eating anything because of the nausea sensation and because of the vomitings and all. So this vomiting sensation is even more frequently faced by them when it is a twin pregnancy or triplet pregnancy, because of the HCG hormone, which is usually doubles and triples in the twin and triplet pregnancy respectively. Because of this problem, they won't be able to feel like eating food regularly. So what we advise is they can take frequent meals, but in short intervals, like not having a large meal at once, which they cannot have. So they can have frequent meals in regular intervals, so that will keep them free from hunger. And one more problem what they face is lack of sleep. So people usually don't get sleep when they are pregnant. They'll have a disturbed sleep pattern because of this frequency of urination is more in pregnancy. So we'll usually advise them to have 8 hours of sleep overall, so that the lady and the growing baby are healthy, and they don't suffer because of lack of sleep. And one more thing what they usually face in the late trimesters is the increased frequency of urination. It increases even more because the growing uterus, as we discussed, puts pressure on the bladder, and because of that there's incomplete emptying of the bladder as well as the bowel. And they usually face symptoms of constipation too, because of the progesterone hormone what gets circulated in our body. So because of the progesterone, there is usually some mild constipation that everyone faces, and because of the iron tablets they take also, they face mild constipation and black colored stools. And one more major complaint everyone tell is usually backache. So why do pregnant people get backache very frequently? So as your stomach keeps growing with the growing uterus, the center of gravity shifts actually. So because of that, there is a pressure on the back, which usually creates a backache, and this backache is usually the major problem what pregnant women face. So for this backache, what we usually advise is some sort of mild exercises, yoga, butterfly flaps, and walking, and all these exercises and yoga, antenatal yoga we advise. And even with that, if it doesn't get relieved, we usually advise some massage on the back with some painkiller gels you can use. And like pregnant women, they are not supposed to take any painkillers without your advice of the doctor. So they're not supposed to take any painkillers. So the mild massage is sufficient to relieve back pain. So if you still have any doubts regarding the symptoms what people face in pregnancy, feel free to visit Nest Fertility Center, Madinaguda, and please subscribe to our channel and please press the bell icon below. Thank you.